I just want to take a few minutes to talk to you really about some of the questions and queries that I've been asked from people like yourself, the viewers who watch me on YouTube and have listened to my site with all the video clips that I've actually put together for you. One of the main common questions I get asked or queries from viewers are basically, what is a kyphosis, what is a lordosis, and if so, how can they be corrected? Just want to start off by answering one of the questions about lordosis. Basically, a lordosis is a curvature of the lower spine, so a lumbar region of the spine. Generally, you'll find like a slight exaggerated curve in the spine. Now, everybody, for example, has an S-shaped spine. Nobody has got a flat back; it's impossible. But basically, the rule of thumb is that the more exaggerated the S shape is, okay, the more pressure there is going to be accumulated into the lower back. Therefore, hence lower back injuries or lower back pain or discomfort. Now, from my point of view as a correctional specialist, a lordosis, unless it's actually what you were born with, it can be easily rectified and corrected. And there's a few key points really that someone would have a lordosis of the spine. Generally, it's going to be stemming from the shoulders and the hips as the two main areas of the body that causes a lordosis. If we look at the shoulders, if the shoulders are in what we call a protracted position, so if the shoulders are rounded forwards or hunched forwards, this is going to be causing a curvature of the upper spine. Okay, now therefore that's going to be putting a lot of pressure on the lower spine, the lumbar region. That's one of the main reasons why somebody will have a lordosis. The second area is the hips. Generally, a person who has a lordosis is going to have an imbalance through the hips. So in other words, one side is going to be higher than the other. And generally, you're going to find that if the pain is more, say, to the right hand side of the body, the back, someone is generally going to be more rotated through the right hand side. So, for example, anybody who takes part in a racket sport, squash, tennis, badminton, and so on, who's right-handed and predominantly right-footed, they're going to find that their hips are rotated through the right-hand side, and this is going to cause all kinds of problems with their lower spine. So, literally, from my point of view, it's very easy to correct these defects in the posture just through some very, very simple corrective exercises, hip-thigh extensions, shelks, isolation work, working on the left and right side individually, and also stretching through the front of the hips. I'm generally going to find that if someone has a tilt through the pelvis, which is one of the main causes of a lordosis, or anterior tilt, for example, the muscles at the front of the thighs, of the hips and the quadriceps are going to be very short and tight, and that's not allowing the pelvis to sit in a neutral position. So just through some very intense P&F stretches that you can do at home in your own front room, some very, very simple exercises to do to actually stretch those muscles out and allow the pelvis to come back from this position back into neutral alignment. Therefore, that's going to flatten the lower spine, take away any kind of pressure in the lower back. If you've got any other questions or anything you'd like to ask me, please feel free to email me. Look at my site, all the details are on there. And have a look at the stretching program. It's a fantastic program we're giving away for free, so please make use of it.